To lower your cholesterol levels with triglycerides. Anyone here dare to put their hand up? Well, we know the statin drugs are bad. There's a written article that was published by Dr. Joseph Mercola today, it was in his newsletter, that states that your chances of developing coronary heart disease or blockages are fourfold greater by taking statin drugs to lower your cholesterol. Now we know that 90% of your cholesterol is produced in your liver. 10% comes from your diet. Contrary to what you've been told in the past, you don't have to worry about too much of what you're eating because your body produces cholesterol. Your brain is 1/3 cholesterol. The lining of your nerves, the myelin sheath, is cholesterol-based. Every hormone in your body is made of cholesterol. And every cell in your body, the outer lining, called the cellular membrane, is cholesterol. So cholesterol is your friend, not your enemy. And so if you take a statin drug, what it does is it stops the production of CoQ10 in your liver, which feeds your heart, and also stops the production of vitamin D3, which is actually a hormone. And with those two things being stopped in the production, we have a barrage of different things that are going to happen to the body. And I imagine Dr. Fleming can speak on this, as with myself, for hours on end. And we run into all these kinds of things with people that come into our offices that want to get better and they don't know where to start. And they're afraid of stopping this and doing this and doing this because they're told if you stop this, you're going to die, which is a bunch of hocus pocus. As a matter of fact, in 1973, there was a strike in Israel. You know, socialized medicine there. The doctors weren't getting enough money. So what the doctors did is they said, look, we're going to strike. And they shut down for 1 month. You know, in that 1 month period of time, the mortality rate dropped 75%? You know? Sort of a frightening thing. Especially when we know that today in our country that between 150 and 250,000 people die a year from the adverse reactions to medication properly prescribed, let alone all the other things that happen. Okay? So, this is stuff to ponder upon. And what Dr. Clements and myself and the other doctor in the back has to offer, Dr. Telmore, we're what we call outside, we're cutting edge, we're like mavericks, you know? When I talked to Carol the other day on the phone, she says, well, what do you do? She says, well, I can look at this and that. I says, but see, I'm a maverick. You know, you ever watch that show Top Gun? Top Gun? The Maverick? Well, I'm the Maverick. See? I think outside the box. I do what's outside the box because my #1 goal is to help you. Education is the key because in Latin the term doctor means teacher. Today we don't have teachers that are doctors. You may see a doctor or you may not. You may see a physician's assistant or a nurse practitioner, but very rarely you see the doctors. Doctors don't have time to talk to you, see? And they don't have time to sit back and say, look, we have to go back in time 10 and 20 years at a cellular level to try to take care of this. Now, the one thing nice about the Hippocrates clinic is that 3-week interval in time you're there, you're in an intensive program. You're like going to college. But at the same time, they're teaching you proper bowel habits, proper eating, what to eat, what not to eat, regulation of pH, and so on and so forth. And that's critically important because I can only spend so much time talking to a person in my office, but thank God we have something of this quality available for people like yourselves to go and see if in the event you have a major problem. When you leave there, what I usually do then is I have people come in and I pick up the pieces. I follow through as far as diagnostic studies and support because you have to have a captain to try to take care of the crop. You know, otherwise you're floundering, you know, because you can't remember all this. You don't know all this stuff. See? After 33 years of doing this in clinical practice, I'm still learning on a daily basis. So the day I think I know it all is the day I hang up my spurs and go fishing, you know? But, you know, that's pretty much in a nutshell. So hopefully that we'll wrap that up and we'll go to the next speaker. Thank you.
Thank you very much, Dr. Badanek. That was great. All right, Dr. Telmore, come on up.
Good evening, everybody. My name is Dr. Palmer. I've been practicing holistic medicine in Gainesville since '89. Before I did pediatrics and emergency medicine for many years and body-mind for many years. So, first of all, I just want to describe briefly what is my practice philosophy, so you know where I'm coming from. Over the years, I realized that your body has potential to heal any illness that you have. You cannot have illness in the first place if your body couldn't heal it. And I realized that what I did in allopathic medicine wasn't really the best thing for the body. So what I learned over the years that if you use modalities that help the body and support the body, basically the body heals itself. Nothing can heal you but your body, but if you support it properly and know what to do in order not to get sick, then your healing potential is basically unlimited. I started with body-mind, where I've worked with people on consciousness and belief system, and I've seen all these people healing themselves from AIDS, cancer, practically anything. But later I got into practice. So let me just explain in a nutshell. This is really important for people to understand. What the difference between allopathic medicine and holistic medicine. So when you have illness, the symptoms actually not because your body is stupid or you have bad luck, it's because your body is trying to heal itself, plus it's trying to give you a message, you've been doing something wrong. God, I believe, created you perfect. So what the conventional doctor does, obviously a very good labeling with diagnosis, then they give you medication which are basically poisons that suppress the symptoms. So basically you're not helping your body to heal. Now if you really want to understand, actually the miracle of your body is that it can handle sometimes for many years of allopathic treatment without having apparent consequences. Some people do it faster, but some people can be on medication for 20, 30 years. But basically what they do in the suppression is suppressing the weakness, the illness, push it back into the body. So if you understand the law of healing of Dr. Herring, that was a great American homeopath that described the law of healing, it's basically saying the disease developed from the outside to the inside, from the periphery skin to the into the body, and from less vital organs to more vital organs, and sometimes from the body to the mind. For example, for that, you have rash, itching, you go to the doctor, oh, it's an allergic reaction, take steroids. Great. Steroids are obviously one of the most dangerous medications, but basically what they do, they didn't heal anything, they push the disease according to Dr. Herring's law. So now there's a weakness established in your body, and each of us has different weakness, different propensities to certain illness. And then the weakness manifests many years later, sometimes months, sometimes years later, never make the connection. But now you develop illness, let's say, if you're weakness in the lung, you get lung condition. If you're connective tissue arthritis. So now you take medication for arthritis, so asthma or lung problem, and maybe they're under control, but now you poison your liver. So now you take medicine, the stomach. Now you have ulcer, so now you take medication for ulcer, and the ulcer may be better, but now the liver is not working, and you can live without the stomach, not without the liver. The example for the mind is a schizophrenic patient rarely ever get cancer. So in the healing, when you start eating properly, proper nutrition, doing natural modalities that support the body, then actually you sometimes have reversal of the order that I described before, because now maybe all symptoms being suppressed may come to the surface. They're usually very mild, you can handle it, and the extreme rare that they're really strong, but you can do something about it. So basically, what you're doing when you use holistic medications, natural medications, you actually supporting your body healing. So the results of any allopathic treatment, I don't care what, you cut the body, you poison the body to heal, you're always going to have problems later. Okay, sometimes many years later. Now, I'm not saying that they cannot save your life if you have trauma on acute severe condition, but generally speaking, you always think twice before you run into getting medications. Now, homeopathy is a very good example because homeopathy works on the principle that like screws like, which means that the symptoms that you have are manifestation of healing. So if you take substance that causes the same symptoms and you're healthy, then it will stimulate the healing. In homeopathy, you don't use the substance itself, which would be toxic. You dilute it in water so many times and shake it. So you give the information to the water, and then you put it in a tincture and then on tablets and you take it. So the effect is energetic. So what it means, for example, if you take the belladonna plant, you eat it, you have hallucination, high fever, they let it pupils red face. Obviously, sometimes you have this picture when you have a good infection. You can go to the doctor, have antibiotics, and be weak for a week, and then have problems right away, or cancer or autoimmune conditions many years later, or you take the belladonna picture, you heal much faster, but the result is that you get better in shorter period of time and you get healthier. So this is the big difference, and if you understand that you will avoid conventional medicine. One more important thing is that there are actually two reasons for illness. The most common reasons are doctors and medications, direct and indirect to illness and death, and ignorance. So I educate my patient, their nutrition is the most important thing. Thank you for bringing it, that's essential, and living food is the best, you can't get any better than that. Then you have stress, heavy metals, electromagnetic pollution, chemical pollution, and so forth. And if you teach yourself and understand how to avoid it, how to change, your chances of healing are exponentially better. Okay, so I do workshop one next Tuesday. If you apply, welcome to come. Also do free webinars on the internet. You can go to my website, my card is there. But the point is that for tonight, the most important thing that you can do, okay, is nutrition. Because living food can heal practically anything or help the healing of anything. The problem today with GMO and chemicals in the food are disaster beyond any proportion you can imagine. Just watch the new movie, GMO Roulette. So, thank you.
I get a copy. Send me an email.
Thank you very much, Dr. Atmore. That was great. You guys getting ready for Dr. Clement here? Enjoying yourself so far? Good. So we're going to be doing a couple of drawings, but make sure you stick around. Okay, we won't do that till the end. On your table, each one of you has gotten a Healing Our World magazine. Amazing information is in that magazine. I myself like to read it, every single article. You also have a brochure from Hippocrates Health Institute. That brochure shows how beautiful the Institute is. It's 50 acres of very pristine tropical beauty. I worked there for 3 years inside as an energy therapist, working with guests with different alternative therapies, kind of heart-to-heart, very intimate, watch people transform their lives. I'm the person to talk to if you'd like to consider going to the Institute. We do have some promotion or some special opportunities for you. I want to make sure that we have our superfoods charts out, so I'm not sure if we've got those passed out, but we're going to get those to you. We've also got some books up front I'm going to talk about, because a couple of people are going to win some books tonight. So like I said, stick around so you can win a book. Dr. Clement will be back here when we're finished, and he'll be happy to sign any books. I don't know how he does it. I'm still trying to figure it out, but he just kicked out 2 books, Killer Fish. That one went back to press because they were trying to focus on the meal over here, which is the plant-based omega-3, the most powerful omega-3 on the planet Earth. So it went back to press and was slightly delayed. But also the 7 Keys to Lifelong Sexual Vitality has just come out. And he's also getting ready to kick out another book, 4 books, massive, 1,200 pages, I believe. And that's going to be to the medical community. And that's going to scientifically disprove the origination of biology. Tonight's topic is going to be quantum biology, so we'll be extremely powered up for you. But essentially, going back to myself and what I offer for you is just some time. If you'd like to talk with me more in depth about the program, I'll make myself available. We do have, like I said, a couple of specials that these are not available at the Institute. And on what's called a superfood chart, so when you come up here at the end, we've got some charts up here. They're quick reference guides for you. On the quick reference guide, there's a company called Permacharts, but the gentleman had such an overwhelming transformation himself at Hippocrates that he has offered a scholarship. So at every event, I can offer 2 individuals a $500 discount to program. And then we also have the 10% off, which will qualify for a 1-week or a 2-week stay. But we do recommend the full 3-week stay, just so you know. After being in the Institute, like I said, for 3 years, the reason that I'm absolutely passionately driven to be with you and to get the message out to the whole world is because I saw so much overwhelming transformation that I feel literally unstoppable. Because there are things that the 2 doctors have already spoken about that are clear and real. And we actually have the